repeat anything Dr. Junaid mentioned, but we'll still talk about some infection control issue and what to do, because this is all for treatment. Dr. Junaid talked about that, so what about prevention? So these are just some of the definitions. That early onset is, some people say 48 hours, some people define it 5 days, some people define it 7 days. On average, 5 days, or that the baby was infected in utero. So blood culture positive within the first 48 hours or 72 hours or 5 days, it's considered early onset sepsis. Late onset sepsis, depending on where your cutoff is, then it becomes after that. So most people will consider late onset is 5 days and 7 days. We actually had a baby, we did a blood culture at birth, it was negative, then on the 3rd day of life, repeated blood culture because he was not doing well, and it was positive, and we assumed it's early onset sepsis too, that we just could not pick it up in the beginning. Now this is not called nosocomial anymore, we all call it healthcare associated infections. So this is healthcare associated infection is any infection that happens to the baby while the baby's in the hospital. So it can be bacterial, it can be viral, it can be fungal, and in many places they consider that healthcare associated infection is something that should not happen. Okay. These are the microbes, most common, coagulase negative staph. Now it depends on which country you're in or which your practice. Candida is a really bad organism to have infection. Okay. Thank you. So Candida is a bad infection because it requires prolonged treatment, it has high mortalities, makes babies sick, and it's fairly preventable in different ways. Coagulase negative staph is infant skin, particularly if we have invasive catheters, GI tract, gram-negative bacilli from the skin, respiratory or GI tract, mostly care provider hands. This is artificial hands. الممرضات في popular مع ladies بيحطوا artificial nails. يعني I don't know if you do it in Egypt ولا لا, بس هنا it's okay, good. يعني it's our nurses are also, they have to clip. Nurses have to clip their nails. They cannot put nail polish colored, and it can have cracks and it can hide bacteria. Our own nurses, they have to tie their hair, they have to clip the nails, no nail polish that has any color in it. So we're very strict in this. No rings, no wedding bands, no watches. المشكلة is in long sleeve for the ladies, and this is a problem for us. So then we have doctors and nurses that are covered. So they have long sleeve. So we tell them what we do. I don't know if it's the right thing or not, but we cannot tell them expose your arms. But when they start, they go to the room and they scrub. So first time they have to clean their hands with soap and water, just soap and water. So we tell them to pull up their sleeve. After that, they return it back. And if they're going to touch the baby, to wear a gown, the yellow gown that has elastic bands. So it kind of holds things, so then they can clean their hands with alcohol. I don't know if this is the best thing or not, but this is what we do. You compromise in a different way.
We have a Martin people, they don't mind.
People, it's a problem for us. Okay. Candida species, actually part of it is, the most important part is GI tract colonization. So there are two ways to prevent Candida. This is infection control. So one of them is to give IV fluconazole twice a week. Okay. So the second way is actually, and it showed in studies from Turkey, that if you give nystatin oral, 0.5 ml every 6 hours, and we do, the nystatin liquid, and we do with a Q-tip, we wipe the baby's mouth. If he's not feeding, if he's feeding, we put it so the baby can swallow. And this prevents GI colonization with Candida and decreases the risk for Candida infections. Cheap, easy. You don't have to remember which day it is. So, and it works, yes.
You do the Nystatin for preterm and term as well?
No, less than 30 weeks. Until they get to full oral feeds.
Yes.
Once they get to full oral feeds, they don't have any catheters or anything, we stop.
Yeah.
For how long?
Until they get to full oral feeds.
And what I mean is, you don't use fluconazole anymore.
I don't, Dr. Junaid does.
Yeah, we use. Yeah. But we,
And I
we
guess
don't
Dr.
use,
Hisham does.
We don't use
There are better studies to show that the fluconazole works than Nystatin. But there are now a few randomized control studies actually comparing Nystatin to fluconazole from Turkey, and it shows that they're as effective as each of them.
In preterm and
One
full term,
study,
no
one-
differentiation.
Hmm?
I mean in preterm and full term as well.
No, we don't use it in full term.
These are
Even if it is for a long time, is not taking oral feeding or something. You don't?
No, we don't.
We are only using it less than 30 weeks because the studies are done in preterm babies. They're not done in term kids.
And fluconazole is less than 1,000 grams, whatever the
Okay.
gestational age. So that's we are using because, as doctor said, that there's no study which tell about the full-term babies. So,
And we generally don't have a problem in full-term kids.
Exactly.
Most of our problems are in small babies or in have IVs for a long time, not
Yes,
feeding.
exactly.
That's what we do. I mean,
Sometimes I think if a baby is going for a long time and is critically ill and he will not take oral feeding, what's the harm of giving him this Nystatin?
We don't know if it works or not.
yes.
So if are you doing it in your unit? If you're
Not
doing
usually,
it,
you know, if
no,
I
if
have
you're
a
doing
sick
it, then it's
baby-
good to say, okay, I've done this.
No,
This is a
no.
group I've done. This is a
No,
group I
no.
didn't, and it works.
Not.
Because we don't have any data that it will work in the big kids. Okay, so this is just quickly, and it's a problem as Dr. Junaid mentioned. We will not really go through why babies have that. I'll go through actually. I borrowed this slide not from Dr. Junaid, but this is actually
No, he's my professor, Dr. Butta.
Really?
Yeah,
Okay.
in medical school.
These data I got from WHO website. Is it focused? Because
No, it's
the
okay.
focus on my screen is better. And Dr. Ahmed can
It's
see
okay.
it. Yeah, just the focus.
Yeah, that's good.
I think it's better now, right?
Yes, yes.
Okay. Because it's good in my screen. So this is from Pakistan. WHO is good because they worry about poor countries. When we look at studies, they're mostly done in US and Europe, and they have different standards, different NICUs. So WHO usually give us data from Pakistan, Bangladesh. There are data from Egypt, which I'll show you. So about that NICU admissions and sepsis. So NICU admissions are increasing, and sepsis, they were high at one point of time, but then they start decreasing by doing few things in their NICU. One of them is involvement of mother. So with involvement of mother, they have more breastfeeding, put the baby to the mother's skin, so minimal visitors other than the mother. So these things seems to help them to decrease infection. This data is from Dr. Yassin from Egypt, and it was presented in a conference. I'm not sure which unit Dr. Yassin is from, but he talked about neonatal sepsis in NICU, and it has very high mortality rate, which we all know, so we all appreciate that. And because babies are all getting lots of antibiotics, and this looks probably familiar. Come on, look. Okay. Part of it is problems with that. So they trained the doctors and nurses on hand washing and how to handle IVs, how to connect the intravenous fluid to the baby's IV without breaking sterility too much. And then they had, even though their admissions were going up, they had less infection. So from this is also about washing, is they had 50% lower incidence of pneumonia in young children. And this is what they recommended to do, that this is called an audit format. So in your hospital, in your unit, you can do something like this, a couple of doctors and a couple of nurses, and they can say, okay, what is it we're doing? So form an infection control team. What is it we're doing? What is it that is not necessary? Okay, what is it that is helpful? And what is where we can spend money and get return? And they say some of this is